Donya, so do you see any movie on Fridays? Like just do you see any movie on Fridays, or do you kind of wait for specific movies? Any movie?
We are just movie fans. The only movies we don't see is we don't like violent movies, both my husband and myself, so we're on the same page. But we love documentaries,
That's
and
amazing.
I like adventure films a little more than he does, and comedies. Yeah, we just have always, since we started dating, we've been married for 36 years. And
Congratulations.
yeah, I wish I had saved those little ticket stubs. He used to tell me to do that when we were dating. I would have like jars of them.
So try to keep normalcy. Dr. Hurst, what do you think about that? You know, do you think that's the thing? So try to keep like as normal life as possible?
Yeah, I think for a lot of folks, it feels like so much is being taken away, as whether or not you have to stop work, or you can't pick up the kids from school for a little bit, or you're unable to sort of do your usual household tasks. Feels like a lot of losses. So where you can maintaining normalcy, I see helps maintain sense of strength and sort of, generativity through all of this.
So what about nutrition and everything? Do you kind of change the way you eat, your patterns while you're getting that? Or you just, you just try to keep a healthy diet, try to kind of go through the chemotherapy, trying to keep yourself, keep your calorie count up and keep your nutrition up.
I did not experience nausea to any degree. I never threw up throughout treatment. They have a lot of things they can give you now, so to navigate that. But I did battle constipation. That was probably my demon. And so as a result, I didn't want to eat anything because I thought anything going in is not coming out.
Right.
So food was just not attractive to me. So I worked on trying to just keep my nutrition up during it, which I made up for after chemo. I made a list of all the things I was going to eat.
And did you eat them?
Yeah.
You went through the list?
Yeah, I've gained a few pounds, yes.
That's all right, hey, that's perfect. Dr. Skander, how do you talk to patients about their quality of life while going through chemotherapy, how to maintain their quality of life? What are some of your thoughts on that?
It's a very important aspect of care. It's daunting enough to go through surgery and then chemotherapy, but if patients begin to run into a lot of chemotherapy-related adverse events that they weren't expecting or weren't educated about, they can begin to develop fear, some apprehension. They worry about the effect it has on the cancer and cancer growth, and not being able to tolerate the therapy. So I think that a really important part of it is to educate, to inform, and to help manage symptoms. And again, this is a multidisciplinary process. And it speaks to the importance of having a great team around you, having good nutritionists and dietitianists, having infusion center nurses who can call you and say, hey, Donya is not doing so well with her infusion. She looks dehydrated. She's telling us she has a lot of nausea. Because many times in our office visits, some of those things are lost in translation, or
It's like a trailer. It's not like a whole movie, right?
Correct. It's a trailer, or the patient doesn't feel compelled to share it with you because they're worried if they share it with you, it may affect their treatment.
Yes.
So it's a multifaceted approach, but controlling symptoms to preserve quality of life and make sure that patients can continue therapy without significant side effects is really important. The cold cap is something that some patients elect to use, and it's an example of a way to make them feel like they're not going to lose their hair with therapy and give them a little bit more power. And like Jeremy mentioned earlier, that feeling of control over some things that you feel like you have no control over many things at that point in time.
So that's great. Dr. Hurst, a couple of things can you give us for patients who are going through, what would you recommend for them? Like any in general kind of ideas that you would, with your practice, that you would recommend for them while they're getting chemotherapy to maintain the quality of life?
Yeah, I think what Dr. Skander says is that some folks do worry that if they share some of their issues, it will delay therapy, or it will mean the doses aren't as strong as they would otherwise be. And so maybe they don't want to share that, but knowing that, we actually have things that can treat constipation really well, or can treat nausea really well. And if we treat the physical symptoms, the emotional symptoms, you're better able to tolerate the chemotherapy or the surgery or whatever the treatment may be. So trying to be as open and honest and getting help from your entire care team is important.
So open dialogue and honest dialogue with your care team is exceedingly important
in
getting through the therapy.